Thanks very much. Just wanted to jump in, kind of starting at that last point in relation to leave, because it is quite possible, and I just wanted to see how many people of your staff have used up all their leave entitlement. How many are sitting there with no annual leave left, having used it up, and what are they doing to manage this? Because it would strike me, and do let me know if I'm wrong, it would strike me that once your leave is used up and then you're into parental leave or you're looking at unpaid leave, and the reality is that many of the staff and the healthcare workers will use up all their leave, will have nothing left for the rest of the year. And it's not just a position of leaving the children at home, but they may be in a position of having to give up the job to maintain decent childcare, which really is just, putting massive further undue pressure on the health service. So just if you could give me an idea of how many have used up their leave entitlements, and do you have any idea what they plan to do when that happens, if nothing changes?
If I might answer, Deputy, in our survey of members, 62% responded that they have used the majority of their annual leave. And when we asked about their spouse and partner, they answered that 48% of spouses and partners also were forced to use annual leave in order to allow the healthcare worker to return to work.
Deputy, just to say that most of the information we've had is anecdotal in relation to members communicating to us as their trade union about issues concerning childcare and the ability to attend work. So there are significant numbers of health workers in that category. I do believe that the health service executives themselves would have more up-to-date data. But just to say that it is a vicious circle, because if this issue is not corrected going forward, should the pandemic present itself again, or there should be serious clusters in the future, then we're going to find our health service not able to provide the service with the professionals and with the healthcare workers essential to operate the health service. We have serious concerns about that. We also have concern about the impact on fatigue and anxiety and stress on health workers right across the spectrum, and how that may affect them going forward. And that's something that I suppose that when the emergency is declared to be at an end, if it is ever declared to be at an end, these issues will start to materialise more and more frequently.
Because it would just strike me that, as I say, if 62% have used up the majority of their leave, and they're going to be faced with either a choice of unpaid leave or leaving the kids in a precarious situation, the stress that goes with that, my fear would be that many of these people may see that continuing in work would be unfeasible unless something changes. So really we need to change and address this issue, or we will be left with a health service that is even more understaffed than it currently is. Thanks.